So when you're doing the exercises at home, I'd like you to try to do them 3 times a day and try to do 10 repetitions using pain as your guide. For the first exercise, you're going to bend your hip and straighten it. So what you're doing is you're sliding your heel up the bed towards your buttocks and then straightening your leg. And once again, you're trying to do 10 repetitions. But if, for example, you have pain at 5 repetitions, then you can stop. So bend and straighten. For the second exercise, you're going to be using a roll. So you can either roll up some towels, as I did here, so it's a nice firm roll, or you're welcome to use like a juice tin, a nice firm surface. You're going to be placing it under your knee. For this exercise, you're strengthening your quadriceps muscle over here, and you're going to push your knee into the roll, and you're going to lift up your lower leg. Your knee does not come off the roll, and your foot and toes are pointed up towards the ceiling, and you're holding for 5 counts. 1, 2, 3, 4, 5, and down. And again, the goal is to do 10 repetitions. So it's up, 2, 3, 4, 5, and down. For the third exercise, it's your gluteal squeeze. And what you're trying to do is squeeze your bum cheeks together really nice and tight, like there's a silver dollar there. You're holding for 5 counts, and then you're relaxing. This exercise can actually be done in lying, sitting, or standing. For the final exercise, you're going to sit either at the edge of the bed with your feet supported on the floor, or you can even sit in a chair. You're going to want your thighs fully supported on the surface that you're sitting on if possible. And what you're going to do is you're going to straighten your leg, and you're going to hold for 5 counts. And again, the foot is all the way up for a better contraction. You're strengthening your quadriceps muscle over here. You're holding for 5 counts, sitting up nice and tall, and down. And for the exercises, you're gonna always be using your operated leg or your affected leg. Once again, always make sure to use pain as your guide. The goal is to do 10 repetitions 3 times a day. After your total hip replacement, there are certain things you can't do called your total hip precautions. You're unable to do these things for at least 6 weeks, and we recommend that when you go to see your surgeon at the follow-up appointment, you ask your surgeon if you still have to adhere to these precautions. The first thing that you're not able to do is you're unable to cross your legs. So if this is the midline of your body, your operated leg cannot cross the midline of your body. The second thing you're unable to do is you're unable to twist or rotate at the waist or in the leg. So for instance, if you had to walk with your walker after surgery and then it was time to turn around, I would turn around with my walker like this, but that's turning or twisting at the waist. If you were to turn and walk with your walker after surgery, it's recommended that you take small steps so your whole trunk is turning at the same time. Another example is, let's say you're in your kitchen after surgery and you have to reach something from the cupboard. I would just twist and reach like this. You would have to take a step and reach straight ahead like that. The final thing is, there's no hip flexion or hip bending greater than 90 degrees. So, when you're bending your hip, I'm looking at this angle over here, and this angle has to be less than 90 degrees. So your knee joint has to be lower than your hip joint at all times. So you have to be mindful of your height and the surfaces that you're sitting on. For instance, if I'm sitting on this chair here, my knee joint has to be lower than my hip joint. So there will be no bending forward in a chair. There will be no bending forward to pick something up from the floor. And things like getting dressed and putting on shoes and socks, your occupational therapist will explain to you how to do those things with assistive devices. Here are some recommendations as to what to bring into hospital from a physiotherapy's point of view. When you're in hospital, the two-wheeled walker and the cane are provided to you during your hospital stay. You will need to rent or purchase the equipment when you go home. When you meet your physiotherapist and your physiotherapy assistant, you will be wearing a hospital gown. And when you get out of bed, we provide you with a second hospital gown to make sure that you're fully covered on your backside. We can provide you with hospital booties. However, it is recommended that you bring in shoes or slippers that have rubber tread and that are closed in the toe and the heel area. Please keep in mind that after surgery, it's normal for your foot and your leg to swell. You will meet your physiotherapist and the physiotherapy assistant the day after surgery. At that time, you might or might not have a PCA, the patient-controlled analgesic. That's a button that you will press to administer a narcotic. If you have a PCA, the patient-controlled analgesic, and your pain is greater than a 3 out of 10, we recommend that you use it prior to your physiotherapy session. However, if you don't have the PCA, you can ask your nurse for pain medication prior to your physiotherapy session. We want you to be comfortable and not in pain during your stay at Northbrook General Hospital and when you're discharged home. We have a nurse pain specialist who works from Monday to Friday and an anesthesiologist on the weekend, and they follow you through your stay in the hospital to make sure that your pain is controlled. Your first day with your physiotherapist and the assistant, the goal is to get up and start walking with a two-wheeled walker. It is a lightweight aluminum type walker that has 2 wheels on the front and no wheels on the back. Your physiotherapist will teach you how to get out of bed, how to get from a lying to a sitting position and a sit to a stand position. The goal for the distance can range anywhere from 20 to maybe even up to 60 meters with the two-wheeled walker. Some people only make it to the door and back. The reason for that is not usually pain limiting. It's normal after surgery for your blood pressure to drop, but with some individuals it might just drop a little bit too much and you might be experiencing some lightheadedness or dizziness. We check in with you throughout your walk, and if your dizziness increases, we'll obviously ask you to return to bed so you don't faint. Later in the day, your physiotherapy assistant is going to review exercises to your operated leg. Those exercises are going to help improve your range of motion in the leg and in the joint, and they're going to improve your strength. It is encouraged that you start these exercises at home now because a stronger leg prior to surgery will lead to a quicker recovery. On the second day after surgery, your IV, your intravenous, comes out, and if you had the PCA, the patient-controlled analgesic, it's removed. You are switched solely to oral pain tablets. We need to make sure that when you go home, the medication that you're on in hospital is controlling your pain for when you go home. The goal on the second day after surgery is to walk further with your walker and to focus more on the quality of your walking. We also practice stairs on the second day after surgery. Stairs are practiced with a single point cane and a railing. If you have stairs at home, please ensure that you have a railing. And if you don't have a railing, make sure that there's someone at home with you that is able to help you with the stairs. If you don't have someone at home or a railing, please try to get a railing installed. Or alternatively, if you're a younger fit individual, instead of using a cane, you can try using crutches when you're going up and down the stairs. When you go upstairs after your joint replacement surgery, you go up with your good leg. And when you go down with your operated leg. You hold onto the railing and you rest your whole forearm on the railing. And your cane stays with your operated leg. So I'm gonna pretend that my right leg is my good leg. So I'm gonna go up with my good leg and step up. And you push into the cane and pull up on the rail. And stay as close as you can to the railing. When you're going down the stairs, you get close to the step. You're gonna place the cane down. You're gonna rest your forearm on the railing. And you're gonna go down with your operated leg. Forearm goes down. Cane, operated leg. And you keep on bringing your forearm down and you can lean into the rail. And stay close to the railing. Your physiotherapist, occupational therapist, and physician work very closely together to determine when you're ready to go home. With regards to your physiotherapy goals, there are certain things you have to achieve before going home. As you know, the hospital beds, the head of the bed goes up and down. And there's even these bed rails, which are really nice to move around with, and they help you while you're in bed. And when you're working with your nursing staff, that's great to use these nice things, but with your physiotherapist, all of this is removed. In order to go home, I'm going to show you the things that you have to achieve. You're going to have to be able to get in and out of bed. So you're going to have to be able to lie down on your own, sit up on your own, stand with the walker, and sit back down. And finally, walk with your walker. Once you're able to do all of these things, then you're ready to go home. It is recommended that you use a two-wheeled walker after your joint replacement surgery, as it is the safer type of walker. However, if you have a rollator walker, which is the type of walker that has the 4 wheels and the seat that you can sit on, we will trial you with that walker on the 2nd day after surgery. If we feel that you are unsafe with that walker, we are strongly going to recommend that you purchase or rent the two-wheeled walker on that day for your discharge home. Rehabilitation is an important part in your recovery after your total hip replacement. If you are eligible, a physiotherapist will come into your home to help you with your follow-up physiotherapy. Alternatively, you might have to go to a physiotherapy clinic in the community. We will help you determine your follow-up physiotherapy after your surgery.